Go ahead and get started. Just wanted to introduce our speakers today. We have several of fabulous ladies from Cochlear Americas today to talk about their products, as well as Dr. Sheryl Lewin, that she will touch on the surgical components at the end of this webinar. So again, go ahead and save your questions in the chat and we will try and address them later if we have time. One last comment, again, just please keep your microphone on mute. And Amanda, would you like to start it off?
I will. Good morning, everyone. I'm just going to start sharing my screen with you all while I'm doing some introductions. So Tiffany mentioned there's myself, and then two of my colleagues are joining us today, Carla and Cynthia. And I'm going to give Carla a little shout out because it's her birthday today, and I feel like everybody needs an extra birthday love during quarantine. So I am an audiologist by training. Prior to joining Cochlear, I was in private practice, and then now I support both the surgeons and the audiologists for Greater LA. So that includes Dr. Lewin, whose practice is just a short drive away from my home, which is great in Los Angeles. And now I support them through surgeries, through programming and training. And then I'm going to let Cynthia and Carla introduce themselves, but they really work directly with patient families, candidates, recipients, helping you support you through your hearing journey. So I'll let Cynthia introduce herself.
Hi everyone, I'm Cynthia Gil-Santillan. I'm a concierge for Cochlear, and my role is to support families of children with hearing loss and also adults that are in need of a hearing implant. So my background is my daughter is a Cochlear implant recipient and is doing extremely well, and I'm passionate about hearing implants and technology. So count on me to help you throughout the journey and support you and with resources, encouragement, and I'm available. Go ahead, Carla.
Good morning, I'm Carla, and I'm excited to work with all of you and help the journey along. I'm the engagement manager, and together with Amanda and Cynthia, we support you through the hearing journey. We're excited to be here with you. My background is I'm a former deaf educator, and I have a license to practice as an SLPA, and I'm also Spanish bilingual, and I look forward to connecting with all of you.
All right, so today we're going to highlight really the key differences between Baha and Osia, tell you a little bit more about the Osia technology. Just in general, why you would consider a bone conduction solution for your child, or depending on who's on the call for yourself, really is that with Microtia, we know that bone conduction is one way to guarantee hearing to the patient. So while there might be other solutions that are put in front of you or other options as far as treating the hearing loss, we really know this is one way to guarantee hearing because we're working independently of the middle ear or the outer ear. So we know that most children with Microtia, their inner ear, their cochlea is functioning completely normal. Really, it's just getting that sound to the cochlea that we need to achieve. So with bone conduction, whether it be Baha or Osia, we're able to achieve that sound transmission directly to the inner ear, regardless of what is going on with the status of the outer or the middle ear. So that's really why we're talking about bone conduction solutions at all for your kids today. So prior to Osia being available as of February, we had mostly Baha Attract was what was being used by Dr. Lewin. And so this is a Baha system that is completely under the skin as far as the magnet goes. We also had the Connect where the abutment would come through the skin, and those were two different options for patients. But just so we can see the difference in how these two devices work, they really are very different in how the transducer is designed. And when we say transducer, we just mean the part of the device that vibrates and shakes the bone and really sends the sound to the cochlea. So I'm going to play here. You're going to see the sound going into the microphone of the external processor. That then vibrates, so it's vibrating on the outside. it vibrates and then sends the sound through the magnet and the implant down into the cochlea. So we see here the sound coming in, vibrating the processor, and then that travels down through the bone to the inner ear directly. So the next video, it's a little bit slow, and I'm going to talk through it since it doesn't have sound. But when we look at how Osia works, there's two main pieces. So similar to Baha, we have a part that's on the outside, so that's your external sound processor. This is what's going to pick up the sound and send it to the internal implant. So this other piece here is our Osia implant. That all goes completely under the skin during the same procedure where Dr. Lewin does the ear reconstruction. So we see that processor on the outside. There's two microphones on that processor, and that's going to help pick up sound. And the reason to have two is to help the patient hear in noise. So there's a microphone facing forward and backward to help you pick up sound from all around you. And that sound is then processed and sent through a digital link. It's like a radio frequency link between the internal and external. That signal is then transformed into a mechanical vibration. So that's where we see the new design of the Osia transducer. And when that vibration again goes right through the same implant that we use for Baha to vibrate the bone, and then that signal is picked up by the cochlea. So those vibrations are moving the fluid inside of their hearing organ. As that fluid moves, it stimulates the little hair cells that send the signal up to the brain through the auditory nerve. So at that point, it's really like you're hearing, just like if the sound had come in through your ear, the cochlea is still functioning the same way. And that's the beauty of bone conduction, is the sound is nice and crisp and clear and natural because we're still using normal cochlear function. So this will be the most technical couple of slides that we talk about, and then we'll talk about it, the more fun sort of what you get with the Osia system. So just to help people understand, Cochlear has been developing Osia for over 10 years. So it is significantly different from our Baha in design. And the reason is that we needed a new way to send the sound if we were going to put it completely under the skin. So this is if you took a Baha processor and you cut it in half. So the part that you see on the outside. So if you take that, cut it in half, you're looking at the inside of that device. And we have our induction coils and magnets. Those are the orange and the green in the picture. And really, those two components are going to convert that signal, that sound wave, into a mechanical vibration. And so it's vibrating up and down here. But really the key is that this air gap is maintained, or the device really stops working. So this has been a great solution with Baha. And really, we know that if something starts to go wrong, or say over time, those pieces with all of their movement start to have some wear and tear, we can really repair or replace the Baha processor, you know, with no risk to the patient because it's all on the outside. But in thinking about putting something completely under the skin, we know that with all of these parts on the inside and the movement between them, I mean, just think about like a car and all the moving pieces and parts that over time they need to be replaced or repaired. We really didn't want to take the same transducer and put it under the skin, because again, we want something that's going to last ideally for the patient's lifetime. So we needed to have fewer parts. You can also see it's kind of a high profile design. It's going to be thicker. And again, we wanted something that could go under the skin without creating a more difficult surgical procedure. So we look at Osia again and the two components, and really this coil and transducer is what we're going to focus on because that's the main difference. And that transducer, so that kind of silver titanium casing, is where we're going to cut away and see what's inside with Osia. So here you can see there's a lot fewer parts and there's no movement between the parts. So when we look at how this is going to last over time, there's not that wear and tear. The way that this works is through something called piezoelectric stimulation. And it's a fun word to say more than anything, but what that means is that it's able to take an electrical signal from the processor and convert it into mechanical energy. So, and you saw in that video kind of the butterfly vibration inside of the Osia transducer is creating that vibration that goes down to the cochlea. So it's all happening under the skin versus Baha is shaking and vibrating on the external processor. We can see it's much lower profile. So we again don't need to take away extra bone. It's exactly the same surgery to that point as Baha, other than instead of putting on a magnet, we're screwing on the Osia implant. So again, nice, straightforward, and it's very powerful. So we're able to deliver more high frequency sound, so better hearing in the speech frequencies with this sort of technology. So in talking about the reliability, again, this was really important to Cochlear. You know, as a company that also has developed the Cochlear implant for over 30 years, we really want to ensure that any device that's going in the body is going to last, you know, ideally for that patient's lifetime. So it does have a 10-year warranty for the internal. This is exactly the same as what our Cochlear implant internal device offers. One thing I can speak to is that we have just launched Osia 2 in the US. So it's the first place it launched in the whole world, which is very exciting. But we have run simulations. So back in our labs in Sweden, what we do is we simulate the use of this device over time. So we just run the device at full gain 24 hours a day. And so in those simulations, we're up over 10 years now, and we're not seeing that wear and tear or the breakdown of the device. So even though it is really new, we did have a first generation that we learned a lot from and we modified the design, but then we also have run these simulations, you know, for that peace of mind that this is a reliable device and it's safe. Again, it can withstand it's a significant amount of trauma, just like our cochlear implant, kind of the same impact rating. So we know that kids are rough and playing and all over the place. So we really want something, again, that's going to be reliable no matter what activities they're doing. So this gives you a little peek of what it looks like under the skin. I think it's important to note that the implant, the foundation of all of this, is exactly the same as Baha. So that part that is screwed into the bone during surgery is the same 3 to 4 millimeter implant that will be used for Baha for years, that we know is really reliable. It osseointegrates integrates or binds with the bone really well, and it lasts over time. It's over 99% reliable. And again, you can see how little bone needs to be taken away to do the Osia implant. So again, same as Baha. So if we see here, the amount of bone that needs to be removed is just enough for the 3 to 4 millimeter implant. To compare that to other bone conduction devices that go completely under the skin, they may need to remove 20 to 30 times more bone to fit the entire device. So the reason being is they're still using that electromagnetic transducer, that thicker, higher profile design, and putting that under the skin. So needing to make more room to accommodate for that. Where here, we've designed this completely new type of transducer, again, much lower profile. To give you an example of how thick the Osia is, so I have a few comparisons I wanted to share here. Hopefully you can see them okay. So we have the Osia implant. This is all going completely under the skin. Just to show you, so this is the magnet here that is going to connect to the magnet on the processor. So to compare, this is the Baha Attract. So the magnet on the Attract is significantly larger, and it's the same size as the magnet that would be inside. So we see these are fairly similar. Just for reference, this is a quarter here, so you can see for size. It may be hard to tell here, but the profile of the Baha actually on the outside is significantly further out than the Osia. So the Osia does lay very flat, where the Baha, because it's sitting on an external magnet, does project a bit more. Even though you see it's longer, it is actually a little bit more low profile and hides a little bit better in the hair or under the hair. So just to give you an idea, now for Osia going under the skin, this picture can look pretty blown up and like it's really thick. So the thickness of the Osia up near the coil, so that silicone piece, it's almost exactly as thick as 2/4. So if you lay 2/4, this is the thickness. And then at the thickest area, so where the transducer is, that titanium casing, it's a little less than 3/4 wide. So if you take that at home, and just to give you an idea, the thickness is pretty equivalent to what our cochlear implant thickness is. And we know that we don't have that bump or projection from under the skin with the cochlear implant. So one of the questions that we were asked ahead of time is to talk about individuals who maybe already have a Baha Attract or Connect and they're thinking about moving to an Osia system. And we might see various reasons for that. You know, there's some people who've had, you know, reoccurring infection or irritation at the site of their implant with a abutment or a magnet. Some people, because that magnet vibration with the tract is magnet to magnet, can have a little sensitivity of their skin. And then there are other times where, because the Osia can provide significantly more amplification, they're moving to that solution for better hearing. I'd say especially in the case of children where we know speech and language is really important, or being able to hear well in noisy classrooms is extremely important. They may move to Osia for the increase in hearing and those high pitches and speech tones. So if we look at where it's sitting, this is a good conversation if you were thinking about transitioning to Osia from a different device. So previously the implant would have been right under the processor. So the implant would be right up about here, kind of top of the ear level or a little bit higher, and then would either sit on the magnet or the abutment. So it all was in this area. Now with the Osia, the implant is going to go about in line with the ear canal. So it's going to be lower. The coil, so that silicone piece is going to attach so that the processor still sits really in the same place. So if you're looking at, you know, on the ear, the processor is really still going to be about in the same place as it was for Baha. The implant's in a different location. So I know Dr. Lewin already has had one transition case, and what we recommend is placing a new implant. If you had a previous implant, usually we say just leave it alone. It's bound into the bone now. We don't want to try to remove it from that bone, but leave it alone, and then she can rotate the Osia processor to avoid that silicone sitting over the old implant. So say we're here, this is going to be under the skin. She may just rotate that slightly to avoid being on top of the old implant. Dr. Lewin, did you want to say anything specifically to that case?
That case happened to work out that the other implant was kind of where the neck was, so we were able to actually position that child, you know, vertically as you're showing here. But yeah, I have a lot of freedom to move around to optimize it if somebody were switching from one to the other.
That's great.
Amanda, can I ask a question? Do you mind?
Of course. No.
So for everybody tuning in, I'm Dr. Lewin's Microtia patient liaison. I didn't really officially introduce myself, but I also have a 13-year-old son that does wear bilateral Baha 5s. And so this is super exciting for me to consider, and especially this transition. I had one quick question just because you have the slide up. So the transducer that gets Osia integrated, do you attach, or Dr. Lewin, do you attach like the magnet part that's on that silicone, or does that just kind of float around? Like,
I can answer that if you want, but you can maybe show the magnet that's located in the Osia. So she's showing you the transducer on the bottom, and the little tiny circle on the top is the magnet. It's small. That's all one piece, just rotatable. But where the implant is where the little circle she's pointing to, that's where you screw in the new Osia transducer to the implant. That's why formerly the implant, like with a Baha, would be where that little circle on top is, and now the implant's moved. So that's why you can't just in most cases, you wouldn't be able to just take out the Baha and use the same implant. But interestingly enough, they are the exact same implant, which is fantastic because it's, you know, just like the abutment, the magnet, and the Osia, they're all using the exact same implant that goes into the skull.
so that top part doesn't need to get special secured. It just kind of stays in place.
No, it stays in place because your body's tissues, you know, it's silicone, so they don't grow into the silicone the way they do to like porous polyethylene, but they form a little covering around that silicone, and that will keep it from moving. You're not going to like have it here one day and there one day. It'll be well integrated.
Okay,
And
Thank
Tiffany, to your point, what we sometimes refer to having to tie down a device. So like with our cochlear implant, we might recommend a surgeon secure it in some fashion, but because there's no screw securing it to the bone. So with this, there's a tiny little, we call it fixation screw, that screws into the Baha implant, and that keeps it from being able to move side to side or change location over time. So that'll keep it standing upright. And then like Dr. Lewin says, you know, over time, the tissue and the kind of pressure of the skin on top will keep it in place as well. No additional securing needed. So to show you some differences again between the processors, there's some similarities and then there's some differences, and we highlighted the main difference, which is really this brand new design or way of sending sound to the cochlea and being able to achieve better hearing even with a device completely under the skin. So with Baha 5, we have 3 different sound processors that could be attached to the magnet or the abutment on the outside. Again, for most kids with Microtia, their bone conduction hearing is completely normal. Their cochlea is functioning completely normally, and they can use that smaller Baha 5 sound processor. So as long as their bone conduction scores are 45 decibels or better, they're going to be able to use that processor. You know, what we see is nice here is if their hearing were to change over time and they would no longer within that fitting range, they could move to a 5 power or super power. Again, those we see a lot more in adults with, I'd say, more complex hearing backgrounds, but it's nice to know there's some headroom there. And even in the Baha 5, you know, for most of these kids, they have a lot of headroom because their bone conduction may be at 0 to 10 to start out with, so they really have a lot of fitting room there. If we just look at what's included in the system, I won't go too much into this because Cynthia is going to touch a little bit more on it. Both Baha and Osia have their own app, which can be used to control the device and to monitor as a parent of a child with this device. So she can talk a little bit more about what's in the app. Both technologies are made for iPhone. So the app can be used with any smartphone, versus the made for iPhone means an iPhone, an iPad, an iPod can directly stream the sound from the processor into that patient's ear, recipient's ear. So if they took a phone call or they're listening to media, you know, I think with kids, if they're watching a movie on an iPad, they could really stream that directly through their device. And if they have 2, you know, they could do 2 as well. And then we have the wireless accessory. So again, both systems include 1 wireless accessory, and I'll let Cynthia highlight what options you have there. So then if we look at Osia, we look at the processor itself. So something nice for especially young children or parents who want to monitor is we have this indicator light at the top here. So if you can see on the processor, there's the indicator light. That can be enabled to constantly provide a visual indicator that the child is in sound and that the processor is working. It can be disabled if you don't want that light to be on, or for, you know, older children that can give more feedback. Something nice is, unlike Baha where you would pick a color, is you actually get all 5 color covers. So with Osia, just to show you, this cover can be easily removed and replaced. You get your processor and then you get all 5 color covers as well. You don't have to choose there. And then one thing to note, so if you see that battery in this picture, it's this piece here with the plus, the positive sign up, facing up. So the battery with Osia is a different type of battery than Baha. The Baha uses a 312 battery. It's kind of your standard hearing aid battery. I'd say typically we see maybe about a week on that battery. It can depend on how much power they need. Osia is going to have kind of a special battery that says Implant Plus on it. So it's a 675, that's the size, but they are a special battery that can deliver more power like we have with our cochlear implants. So because all of the information is being sent through this digital link from the outside processor to the coil, so to this coil here, it does take a lot of energy. So what we see for Osia is about a 2 to 3 day battery life. And you will want to use these kind of special batteries, which you can get, you know, typically people buy in bulk on Amazon. So you're going to replace the battery a little more frequently because we're using this more advanced digital technology. Something good to know is that if they're doing a lot of streaming with an accessory like a mini microphone or through their iPad, it's not going to really affect the battery life by streaming. has about a 5% effect, so really minimal effect. And then the other piece I'll highlight on the slide is that the magnet that goes on the inside, so the magnet in the implant is the same for everyone. The magnet that changes based on the thickness of skin is in the processor. So we see it right in the middle here, and it can be one of 4 strengths. So typically for kids, we recommend a 1 or a 2. And that's something that's actually calculated during the fitting just to confirm we have the right magnet. And that can be changed by the audiologist, or over time, say that the child grows and the skin gets thicker, the tissue gets thicker, we could go to a stronger magnet. Ideally, we just want the magnet that's strong enough to keep it on the head without being too strong. We don't want to wear down the tissue or the skin where those 2 magnets meet, so just enough to keep it on the head. But the nice thing, because this is lighter than Baha and lower profile, is it does stay on the head, I'd say much better than the Attracted, and we still have a few retention options to keep it safe and secured, especially for kids. So from there, I am going to let Cynthia talk more about the additional items that are included with Osia, and some of those, again, similar to Baha, and then we will wrap up with Carla.
Yeah, so Amanda was sharing about retention options. So on the left of your screen is a headband, and so that has a small pocket where you can slide the Osia sound processor, and this can be used for, you know, when your child is playing sports, soccer, tumbling, what have you, just a little bit better way to secure the sound processor. And on the right, the top right, is the safety cord, and this can be used to attach it to a shirt, or if your child's swimming, you can also attach to this waterproof case. And there's also hair clips that come in different colors, where just for extra security, in case you have a smaller child that's very active, that way it won't drop to the floor, it'll just dangle. And this is the Aqua Plus. So this is very exciting because this is new to bone conduction, being able to use your sound processors while you're swimming, while on vacation, at a water park, or at the beach. So the Aqua Plus is a soft silicone cover for the Osia sound processor, and it makes it waterproof. So you can enjoy, you know, some good swimming, you know, several hours. It also has a retention clip that'll tie to like a swim shirt, or you could wear a little swim cap over it. So I think this is going to be very exciting for those kids that have had to go without the ability to hear while they're in the water. And we'll go to the next one. And one of the features that's in the Osia sound processor is a scene classifier. It's called Smart Sound IQ. And what this technology does, it identifies the recipient's sound environment by scanning the sound environment about 200 times a second to identify if the recipient is in a quiet environment, a noisy environment, an environment with music or wind, or if there's speech and noise or speech and quiet. And the microphones will adjust to help minimize noise and to boost speech. And this is automatic.
Yeah, I was going to add here, this is the same Smart Sound IQ more or less as what we have in the Baha device. So this Smart Sound IQ is in Baha 5. There are some advancements to our feedback manager and to the sound selector. So a couple of the features were improved, and with that sound response, we do see kind of a wider frequency range, or I should say, like if you're thinking about music, we're seeing a more robust sound quality here with Osia, and we'll get to that in a little more detail. But more or less the automatic adjusting in the background is happening in both devices. Our goal is that your child would just put on the device at the beginning of the day and leave it, and the technology is really going to do the rest to help them hear their best in different environments.
These are the wireless accessories, and they may be familiar to you if your child has a Baha 5 system. The mini microphone, which can act as an FM system in the classroom. It helps to overcome noise and distance. And it's a third additional microphone that will directly stream the audio directly to the sound processor. So you want to use it in situations where noise and distance are a factor, like at a sporting activity, in the classroom, if you've got little ones, like during stroller time. The middle device is a television streamer. It connects the TV's audio directly to the sound processors. The next device is the phone clip. For those that are Android users, will connect your Android phone directly to the Osia sound processors. And for those that don't use smartphones, there's also a small remote control that's available. And this is a view of the Osia Smart app. So the Smart app gives you the functions of a remote control just from your iPhone or from your Android phone. You can download it today by searching Osia Smart app in your Google Play Store, on the Apple Store. And it's very convenient. So just from your phone, you'll be able to make changes to volume. You'll be able to locate a lost sound processor. It's got great features like a hearing tracker and different functionalities where you'll be able to set settings for different, locations that you frequent, similar to the Baha Smart app, but with some additional features. And it's also available for those that use Apple Watch.
And I would say too, just in being out with families or meeting them at different conferences or seminars, even with Baha 5, a lot of families didn't know about the Smart app or haven't installed it. So if that's something, you have a Baha device now and we can help you with getting the app or understanding how to use it, feel free to reach out on that. I think the favorite feature for a lot of parents is there's a Find My processor. So just in case, that child loses their device, there's kind of a hot and cold nearby where you see that you're getting closer to the processor. So if you know it's in their bedroom but don't know where, and then there's also a GPS locator if it fell off while you're out at the store and you're trying to find exactly where it is. So that's some nice peace of mind for parents to be able to monitor the device. So from here, I'm going to just talk a little bit about the candidacy. So we talk about really the age differences that you might see between Baha and Osia. So again, Baha, we are a FDA regulated medical device company. So both systems have these FDA indications unique for the US. And really what it is a guideline. At the end of the day, Dr. Lewin can discuss with you your unique situation for your child and talk about which device may be more appropriate, some different considerations maybe around insurance coverage. But we see that Baha is approved for patients 5 years and older. Your kids or Microtia patients are going to fall into that conductive hearing loss. So really we just want the bone conduction with Baha to be 65 decibels or better. Again, most of them are going to have normal bone conduction, but 5 and up. Now the Osia indication is for 12 and up. And a lot of people have asked me why, because it's the same implant and really the same surgical procedure as what we would use with Baha. You're not taking away any extra bone. The patient doesn't need to have a CT scan ahead of surgery or more bone removal. So 12 years and older is because there was another company who came out with a bone conduction solution that was fully implanted for 12 years and older. So really to make this device available as quickly as possible, we moved forward and really piggybacked on that 12-year and older indication. Now with additional surgeries and clinical evidence, we hope that we'll be able to lower that indication over time to be similar to Baha, just because again, the surgical procedure is very similar. And we don't see any, increase in risk or safety for Osia when compared to Baha. So just kind of talking about why that is there. And even if your child is under 12, I'd say that's a conversation to have with Dr. Lewin and see which one would be best for your child. So here's really the exciting part, how we see Osia is performing differently than Baha. So in the past, we talk about Baha Attract with the magnet, and then the abutment is the connect. So really to get the most bang for your buck, the connector, the abutment was the way to go to give you the most hearing or the best hearing in the higher frequencies. So when we talk about high frequencies, those are going to be a lot of your consonant sounds that begin or end words, your F, S, S, T, H. So a lot of those finer, high-pitched sounds that are pretty soft when you think about speech. In the environment, it's like a bird chirping, the higher pitched sounds in music. So maybe like your flute sort of sound. This is where we really see Osia can deliver more amplification. So even compared to the abutment, we're getting about 12 decibels more in the high pitches. So to kind of relate, what that means is for every 6 decibels of increase, it's almost like you have perception that it doubled in loudness. So it's a pretty significant improvement. We're also able to give that recipient hearing out at 6,000 hertz. So this is a pretty high frequency that we couldn't always obtain with the Baha device, and we can with Osia, and that's going to result in better hearing in a noisy environment. So we're seeing in our early studies, they're improving their hearing in noise. They're able to hear at softer levels. They're able to hear more clearly. And just the overall sound quality. So music sounds better, speech sounds more robust. So thinking about that, I'd say we are talking about, are there any cons to the Osia system? And the only thing that I've observed so far is, especially for kids who are going from a soft band to an Osia or no device to an Osia, is they're going to get substantially more of those high pitches than they have ever had before. So what we're seeing is sometimes at the first fitting, we even turn it down a bit to really help them acclimate to this new sound, to be getting more sound. And then over time, we can increase it. And we also mentioned, as a parent, you have that smart app. So as they get used to it, and if they felt they needed more volume, you could increase it between visits with your audiologist. But it may take some time to ramp up to that full amplification. And really, I think what's important to know here is this is what's available. There's much more gain or amplification available. We may not always need to use it. So because the device is adjusting automatically, if a really loud sound comes to your child's ear, so like a loud clapping or something breaks in the kitchen, it's not going to amplify that in a way that would become uncomfortable. It's going to control the sound to keep it at a comfortable level. Versus if I'm whispering to that child, it's going to increase the amplification. So we really can help them hear those softer sounds better, especially in noisy or challenging environments.
Hey, Amanda, if you don't mind, just confirm, what is the increase in amplification from a soft band to an abutment per se, like 5-10 decibels?
So, sorry, I just got something in my throat. So let me take a quick sip. So I can actually send you a graph as well that compares soft band to attract to connect. And then we know that the Osia is getting about 12 to 15 decibels more than the abutment, and about 40 decibels in some studies than the attract and the high frequency. So again, we really see a significant improvement if you're looking for something under the skin. So from soft band to attract, you know, you're probably going to get at least 6 dB more, especially in those high frequencies. That's where we start to see the major differences going from a soft band. And then, you know, an increase, you know, of even, I'd say another 6 to 10 dB. And I don't want to put out exact numbers. I think the graph will show better exactly the difference of the different frequencies. So it really goes soft band, you know, attract is going to give a little bit more, especially in the mid to highs, and then a connect before would give even more. And now we see Osia can bump up those high frequencies an additional 12 decibels.
Like, I just realized when we went from a soft band, and again, bilateral soft band, to the connect, like the increase was unbelievable. So then when he would wear his Baha or for his soft band for sports or whatever, or just even would wear one, it was just such a difference. So the fact that you're saying it can go from the soft band to the connect and then Osia's up here, I mean, especially if you know, have more significant hearing loss or you just want to hear clear, I just think, I mean, that's, you know, for me and those speech sounds with him in school, like losing the front and the end of words, I think, you know, that's really, really interesting.
Right.
So,
and especially,
thank you for
I mean, you
clarifying.
think about like a bilateral recipient, I mean, they really rely on that sound from both their ears. They can't fall back on the, you know, other ear hearing for them. So even more important, I think, as an audiologist, we got really excited about Osia when we saw this high frequency response and improvement for kids. You know, they're in really challenging listening environments at school, at their different activities. So this is really important when you talk about, one, being able to understand speech, but then also to produce the different sounds of speech.
And if mom's yelling in a really high pitch, you never know, you know, they got to be able to hear you, right?
Exactly. Or
Right.
yelling from 3 floors away. So I'll let Carla wrap up with just how we can support you and answer your questions. And then we'll see if there's any questions in the chat box and let Dr. Lewin finish.
Thank you, Amanda. I also want to piggyback on that high frequency topic that you were just going over. When we think about reading and reading development in children, we want to make sure that they have access to those high frequency sounds. And again, those are those voiceless, S like Sam, T like Tom. And we want to make sure that they have access to that so they can learn to blend and put those building blocks together to begin reading. So thanks so much, Amanda and Cynthia, for going over Osia. Hopefully everybody on this call is super excited about this new bone conduction solution. There is nothing else like this, and we're so excited to be able to bring this to you. Again, my name is Carla, and together with Amanda and Cynthia, we work with the Osia candidates and their families. Because we know Osia is different than Baha in the sense that you can't try it before surgery, we want to make sure that you can become connected with Osia recipients who not only want to share their story, but they're excited about what this solution has brought to their lives. So if this is something that you're interested in doing, we'd be happy to connect you as well. So Cochlear's community, services, resources, support are an additional benefit when you become a Cochlear recipient. And for those of you who are Baha recipients, you're already receiving some of these benefits. We would love to see you in New Orleans in 2022 at the Cochlear celebration. We are community, and we want to make sure that you feel connected in the solution that you have chosen for yourself or your loved one. So if you have any questions regarding the system, connecting with a recipient, our services and commitment, we invite you to connect with us. On the next slide, you're going to see our contact information. And, we look forward not only connecting with you, but to answer your individualized questions. Look, we know that everybody's hearing journey looks really different, and it's not a one size fits all. We're happy and feel privileged to walk alongside you with this journey to Osia, and we look forward to connecting again. So thank you, Tiffany and Dr. Lewin, for the opportunity to share with your patients today. And if you have an opportunity to take down our email addresses, they're on the screen there. And we look forward to connecting with you. Thank you so much.
Thank you, guys. I think I'll just pop in a few minutes here, just briefly. But I want to thank Cochlear. All three of these wonderful ladies have, been incredibly supportive to our patients and supportive to my practice as well. And I feel like, people need to understand I'm a plastic surgeon. I don't have any specialized training in ENT or audiology. But obviously, given that I treat Microtia and Atresia kids and adults, I have a keen interest in staying on top of all the hearing solutions that are out there for patients. So the way I see my role is merely to provide information for all options. I personally never tell a patient, you should get this system, any system. I like that there's all the options out there for them to trial, talk to their audiologists and their ENTs, and come up with, as a family and with these resources, a solution. I can offer multiple solutions in the OR, but all of them, I don't do atresia repair, obviously, but of the bone anchored conduction systems, I do all of those, and can do it at the same time as the ear reconstruction if your bone is determined to be thick enough. I just wanted to touch on a couple thoughts, which is the age issue, I think is one of the biggest ones. So as Amanda kind of explained, in order to get this through the FDA and available to our United States patients, they used an indication that was kind of, as she said, piggybacking on another device. So that's why the 12 years old came from. From, I think, almost all surgeons' standpoints, since it's the identical procedure that we do for the Baha Connect or the Baha Attract, you know, either the abutment or the magnet, then this would simply seem to be indicated for the exact same ages as those. And for those, we can do 5 years and older. Not every 5-year-old's skull is thick enough, but usually by 6, it is. Occasionally younger are thick enough. If you have a thick-headed kid, so to speak. But anyways, we just, the thing that's nice about doing them at the same time as an ear reconstruction, combining those two, is merely that for any of the devices, there will be no scars. And that's because, you know, when I'm raising the flap, which elevates the hair-bearing portion of your scalp, so to speak, to get to the flap that I use, I'm already got a wide enough field that I can place any of these devices and there won't be any additional scarring. So that's, you know, a benefit, maybe a little more of a benefit to a boy that has short hair, because those scars are often visible if they're being inserted, you know, by another surgeon at a different setting, so to speak. So let me just check if I had any other.
We have a question from the group, if you don't mind.
Sure.
This is from Megan. Hi, Dr. Lewin. Can you talk about implanting the Osia into a post-op 3D Lewin ear? Would a local surgeon be able to safely navigate this implant given the specialized 3D implant and flap? Great question.
Yes, it is. And yes, I think local surgeons are able to do any of these implants pretty safely on any, you know, standard 3D Lewin ear, you know, unless if it was a redo or somebody else's surgery initially, it gets a little more complicated. But on one of my typical first stage, 1-stage kids, that's not a problem. But I will say, I believe communication is really, really important with that surgeon. And I'll just make this one point that I never really make in a more public forum, but since people are listening, just to give you an example, let's say you're bilateral and you have 2 porous implant ears and you go to surgery locally to get this Osia placed or magnet or whatever. I feel very strongly they need to protect your other ear while your head is, you know, down on the table, and there's a very special way that we protect it. So it's just suspended in air and there's no, it's not lying on a pillow or a hard OR bed or anything like that. That's not something that if you're not making these ears, you wouldn't necessarily know that you can't like lean on this child's head without protecting that opposite ear. So it has come up, you know, once in one of my patients, and fortunately that patient had an injury to the ear, but it happened to recover on its own. Like it was fine, but it does make me feel like I always want to talk to, you know, any ENT that may be operating on your child. The only other downside to that one is the scar. They wouldn't likely be able, like on a 2nd stage, I can still do it scarless. I just go where my skin graft was. I'm not sure anybody else would do that. It's possible, I suppose, but I think they'd have to go into the hairline.
And I can say that for surgeons that we've seen so far who are placing Osia that aren't doing your type of reconstruction, but maybe a previous reconstruction already happened, or they're planning for a future reconstruction, we'll see that they often will tend to go with more of a posterior incision. So they'll go behind where the Osia would be to avoid the ears. If we look at this here, they might go back here to avoid the ear, the 3D reconstruction, and we can help with guidance.
It's good from a safety standpoint. The only downside is those scars, if your hair was short, would be visible.
Exactly.
Great. Did anybody else have any more questions? If not, Dr. Lewin, did you have any more items to address?
I just want to thank everybody for joining in to our Zoom, our new, like everybody's Zooming, I guess. So we just appreciate the opportunity to try to educate our followers, so to speak, on all these topics. Stay tuned for more to come.
Yes. Thursday, we do have Caring for Your Post-Op Ear with Dr. Lewin and our nurse Maribel. So that's something also to tune in. But I do want to thank all of our speakers today, Amanda, Cynthia, Carla, and Dr. Lewin. Not only were they super informative and helpful, they all washed their hair and put on makeup for everybody today. And we all know what a feat that is right now. So cheers to that. So anyways, thank you all for tuning in. If you missed any part or want to view it again, we will be uploading this webinar at some point and sending it to everybody. So stay tuned. All right. Thanks, everybody.
Thank you.
Bye.
Bye. Oh, look at Owen. Oh, hey guys. Hey, Gracie.
Hey. Oh, that's awesome. How are you? That's cute.
Oh, there's Kathy. Hi, Kathy.
Look. Wearing
Isn't it
her
fun?
bra.
Awesome.
Oh my God, so cute. That's funny.
That's kind of the fun part, to go look.
Ah, Kathy.
Hi there.
Dr. Lewin.
Just thought I'd get informated.
Are you sewing? She's sewing a mask.
I'm sewing.
Is. I know. I'm calling dibs on one of those. I got to get my order in.
Uh-oh. Mask or hats?
Mask, I think. I'm boring
Okay.
on the hats.
You want a gray one, right?
No, I'm gonna branch out. I'm gonna do a few colors.
Okay.
Dark gray.
We'll have to pick colors.
That one looks nice.
Well, messed up on it.
Oh, you can give me the messed up ones. I don't mind. I'll wear them happily.
No, it blew through.
Oh, okay.
Anyway, seems
Thanks for
revisited.
joining, Laura. 13 and have Microtia. Thanks for joining in.
Say hi to them.
Hi, sweetheart. How are you?
How are you? Say,
Hi, Grayson.
I'm good. See you soon.
Your hair is so long.
It's so long. Yeah,
I mean, really, she's gotten so big now.
I know.
I hope I'm going to see you pretty soon.
Yeah, no kidding. See you in July.
All right. You guys stay safe.
Well, Tiffany, thank you.
All right. Bye, guys.
Bye.
Everybody.
Oops.